Okay, this is the second video on the digestive tract, and we're going to start by looking at each of the individual areas of the digestive tract. And we're going to start by looking at the oral cavity. In the oral cavity, we talked about in general A&P the different structures in the oral cavity, like the teeth, the tongue, the mucosa. We're going to actually start by looking at the salivary glands. So this picture right here kind of gives you an entire overview of the entire digestive tract. We're going to focus right now on the salivary glands. So up here you can see in the picture we have the three different sets of salivary glands. This would be where I'm coloring in red. That's the parotid glands. And then we have the sublingual glands, which would be under the tongue. And then we would have the submandibular glands, which are underneath the mandible, a little more posterior. So the three types of glands, again, are the parotid glands, and then we have the submandibular glands, and then we have the sublingual glands. Okay, so let's start talking about each one of those. So first of all, the parotid gland, it makes up only 25% of the saliva that you produce every day. It secretes an enzyme called salivary amylase. Salivary amylase breaks down starches and complex carbohydrates into more simple sugars like glucose. And the parotid gland then is going to empty those secretions into the parotid duct, and that's going to empty into the mouth. Mumps is an infection that targets the parotid glands in 5 to 9-year-olds. And after a person has mumps once, their parotid glands get really swollen, and that's why we call it mumps, because their cheeks kind of puff out. But after they've had the mumps once, then they have permanent immunity. In adults, if an adult didn't have mumps as a child and gets it as an adult, it can affect, in the males at least, it can affect their testes, causing sterility. The sublingual glands, they make only 5% up of the saliva, and they're on the floor of the mouth. They produce a mucus that acts as a buffer and a lubricant. So mostly what they're doing, they're producing mucus. The mucus makes the food really slippery, helps it to slide down into the throat, into the esophagus, so it can get into the stomach area. And so it empties, the mucus empties into the sublingual duct and then goes into the mouth. Then finally we have the submandibular gland. That makes up the most amount of the saliva, 70%. The submandibular glands are on the inner surface of the mandible, and they empty into the submandibular duct and then into the mouth. They secrete buffers and mucins, which are glycoproteins, as well as salivary amylase. Again, salivary amylase starts the digestion of carbohydrates, so carbohydrate digestion begins in the mouth. So saliva, let's just talk a little bit about saliva. Okay, saliva is produced at 1 to 1.5 liters per day, so that's quite a bit of saliva. And 99.4% of it is just water. Okay, just water. The rest of it's going to be electrolytes like sodium and chloride and bicarbonate. Then there's some buffers and those mucins, which are glycoproteins. There's antibodies also in saliva. And then there's some enzymes, which we talked about, salivary amylase, and then there's wastes. A couple of things that you should know about saliva production is that the saliva production increases when you eat. So when you're putting food in your mouth, it helps to lubricate the mouth, lubricate the food, dissolve chemicals to stimulate the taste buds so you can start to taste things. It begins that carbohydrate digestion using salivary amylase. And then there's another enzyme called lingual lipase. And lingual lipase isn't produced by any of these glands. It's produced by some glands under your tongue. and lingual lipase helps to digest lipids into smaller droplets, so just into smaller lipids. Okay, so we have lingual lipase that's added to the saliva. It's just not produced by one of the glands. So carbohydrate and lipid digestion actually begins in the mouth. Another thing that you should know about the salivary secretions is that it can be reduced by certain things you might see in your patients. It can be reduced by radiation for a patient that's going through radiation therapy. It can be reduced by emotional distress. Some drugs can decrease saliva. Sleep factors can decrease saliva, and then age, as well as a person ages, they're going to produce less secretions. And it's important because one of the things that saliva does is it helps to wash away the bacteria. And so if a person has less saliva than they should have, they have a higher susceptibility to dental cavities. So saliva is going to be regulated by the autonomic nervous system. So the parasympathetic nervous system, which is your rest and digest nervous system, it's going to increase salivary secretions, okay? And the sympathetic nervous system, which is your fight or flight nervous system, that is going to decrease the secretion, and any secretions that are being produced will be thick and small. Okay, so not very much and much thicker. So the cranial nerves that are sensing objects in your mouth or sensing the chemicals through the taste buds, those sensations have to travel back to the central nervous system. And so as far as like taste buds, when you're tasting things, the taste buds are going to activate or stimulate the cranial nerves 7, 9, and 10. So this should be kind of familiar. We know that on the tongue, and the anterior 2/3 of the tongue, cranial nerve 7 will monitor taste. On the posterior 1/3, cranial nerve 9 will monitor taste. And in the throat, cranial nerve 10 monitors the taste. So the taste buds pick up that taste sensation and send it back to the brain. And then the brain's going to send out motor commands to these salivary glands telling them to secrete. Another thing that can stimulate the salivary glands to start secreting are just objects in your mouth. So objects. So when you say you put some marbles in your mouth and you were just rolling them around in there, they don't have any taste, but just that sensation will stimulate cranial nerve 5, which is the trigeminal nerve. And then the trigeminal nerve sends that information to the brain, and then the brain sends out commands telling your salivary glands to increase secretions. So you probably remember cranial nerve 5, we said that was like touch to the face. I had you touch one side of the face, then the other side of the face. Can you feel this? Can you feel this? Well, that cranial nerve 5 is also monitoring touch on the inside of the mouth. Okay? Then from the oral cavity, we move into the pharynx, right? So this pharynx is the connecting area. It's also known as the throat in more common terms. And the throat connects the oral cavity to the esophagus. So here's the pharynx, okay, right in there. So it's connecting the mouth, the oral cavity, to the esophagus, which is your food tube, right? So the pharynx is actually a common pathway for both the respiratory tract and the digestive tract. It allows both air and food to pass through it. The air will be going from the pharynx into the trachea, which is in front of the esophagus, and then food will lead from the pharynx into the esophagus. Okay, so we're going to talk just very briefly about the pharynx. There's 3 different regions in the pharynx. We have the nasopharynx, which is going to be the area closest to the nose. Then we have the oropharynx, which is right behind the mouth at the back of the throat that you can see when you open your mouth. And then we have the laryngopharynx, which is just a little further down, and that's closest to the larynx. So the pharynx is made of stratified squamous epithelium. It receives the food from the mouth, so it's going to take a lot of abuse and there's a lot of friction against it. Swallowing is going to push the bolus of food into the esophagus, and the esophagus is what we're going to talk about next. But let's first look at what swallowing entails. So another name for swallowing is deglutition. That is the medical terminology for swallowing. What happens is that first the soft palate and the pharynx elevates. Okay, so they both elevate. And then the larynx will elevate. So then the larynx elevates. And then the pharynx will push the bolus of food down towards the esophagus. Okay, so there's just three little phases there that occur. There is a swallowing reflex. The swallowing reflex is when the bolus of food touches the palate and the uvula. The uvula is the little flap that hangs down at the back of the soft palate. So as soon as the bolus of food touches that palate and the uvula, that information is relayed to the swallowing center in the medulla. So the sensation sends a message to the medulla. Okay. It sends that message through cranial nerve 5, which is the trigeminal nerve, and then also cranial nerve 9. They both can send that sensory information to the medulla. Then the medulla gets that information and it signals motor neurons that are going to produce a coordinated pattern of muscle contraction. So the motor commands are going to come through cranial nerve 9 and cranial nerve 10, which is glossopharyngeal and vagus nerve. Okay, then let's look at what's going to happen in the esophagus. So first of all, let's take a look at our esophagus here. Our esophagus is about 10 inches long, and it starts up by the pharynx and it ends at the stomach. Okay. The esophagus is going to enter the abdominal pelvic cavity at a region that's called the esophageal hiatus, and that's an opening in the diaphragm. So if we wanted to draw it on here, it would just be, there'd be an opening here, okay, and then this would be the diaphragm right here, right, and so that that opening right there, that is called the esophageal hiatus. Okay, so you might have heard at times like an esophageal hernia. That's when the stomach starts to protrude up and above where that opening is. So I have the opening probably a little higher than where it actually sits. The stomach and the liver are going to bump up right against that diaphragm. The esophagus is just a tube that's going to transport that bolus of food from the pharynx into the stomach. In the esophagus, there are some glands that produce mucus to help to make it more slippery. At the top of the esophagus, there's 3 layers of smooth muscles in about the top 1/3 of the esophagus. And those smooth muscles form what's called the upper esophageal sphincter. The upper esophageal sphincter helps to prevent air from entering into the GI tract. It also helps to protect against a reflux of food moving into the airways. So we don't want food coming back up and going into those airways, and we also don't want air getting down into the GI tract. So it's helping to prevent both of those. Now at the very bottom of the esophagus, we have another group of circular muscles down here, and that is known as the lower esophageal sphincter. So the lower esophageal sphincter prevents acids and stomach contents from traveling backwards up into the esophagus. Sometimes what we see in people that have reflux is that the acids have destroyed the lower esophageal sphincter, and then the acids move up into the esophagus. leading to heartburn and acid reflux and potential for esophageal cancer. So at rest, both the upper esophageal sphincter and the lower esophageal sphincter should be closed, and then when you're actively eating and swallowing, then they would open. During vomiting, when there's a forceful propulsion of food back up from the stomach all the way out through the mouth, both the upper esophageal sphincter and the lower esophageal sphincter would have to be relaxed. They're both smooth muscles, so they're both under involuntary control. Now we're going to move into the stomach, and we're going to look at a different picture, but I'll just go over some of the things that we see right here. So from the esophagus, food moves into the stomach. We're going to look at the gastric pits. Gastric pits are lined with cells that produce mucus. We're going to look at the gastric glands. Gastric glands have cells that release, parietal cells that release hydrochloric acid and intrinsic factor. We're going to look at the chief cells that release pepsinogen. Then we're going to also look at some of the enteroendocrine cells in the stomach. These are cells that are in between those mucus cells, and they produce things like gastrin, somatostatin, ghrelin, leptin, and obstetin. These are all hormones, so we'll be looking at those as well. And then we'll just talk a little bit about how the stomach is being controlled, how it's regulated. Here's all the different parts of the stomach. So here we can see the esophagus, and again there would be a lower esophageal sphincter right there. And then from the esophagus, the first part of the stomach is called the cardia, and then there's this large sort of a superior bump on the stomach that's called the fundus. The cardia leads into the body of the stomach, and then the stomach starts to taper down, and that is called the pylorus. Okay. There is a curve on one side of the stomach that's a little smaller curve. We call that the lesser curvature. That's on the superior part. And then there's a greater curve on the other side of the stomach that's a much larger curve. The stomach sits on the left side of the body. Okay. Inside the stomach, instead of having these circular folds, we have large folds that are called rugae. And the rugae are there because when the stomach starts to expand, because there's food in there, the rugae allow for the expansion, they flatten out. At the end of the pylorus, where it tapers down, so the pylorus is part of the stomach, but at the very end of that stomach, at the very end of the pylorus, is a smooth muscle that's called the pyloric sphincter. And the pyloric sphincter stays closed until the stomach is ready to empty. When the stomach empties, it's going to empty into the duodenum. And that duodenum is the first part of the small intestine. So let's take a look at the histology. What I want to take a look at here is the inside of the stomach. And we're looking at the cells that line the stomach. So in this picture here, you're seeing the lumen of the stomach right here. And so up in here, this is where the food would be. This is where the enzymes would be. This is where the acid would be, right? So that's where it ends up. But there's all these rugae. And so we see these rugae as these big folds, right? They're folds that go all the way down and come back up. They're just much bigger folds than the circular folds are. And then we're going to look at a closer picture of these folds because the cells that line these on the inside of these folds, they produce what we call the gastric gland and the gastric pit. So let's take a look at a big picture. We're going to blow one of those up, and we're going to look inside here, and we're going to see what's going on right inside those indentations. All right, so here we go. This is showing one of those huge indentations, and then that rugae would continue this way. There would be another one over there. All right, so let's look at the different cells that are lining the inside of the first part, which is called the gastric pit. So these cells are all mucus cells. Each one of these cells here are mucus, and so they're going to produce mucus. The mucus cells produce mucus, and the mucus lines then the whole stomach. It's going to line the stomach, and it protects. It serves as a protection of the stomach wall so that it won't be destroyed by its own secretions. Okay, so that mucus just lines the entire stomach wall. It also makes it very difficult for anything to be absorbed through the stomach, but it is protecting it. Okay, deeper than the gastric pit is the gastric gland. Now the gastric gland also has those mucus cells that are lining the walls of the gastric gland. Okay, but they also have other cells in between. And so those other cells, one of the other cells is called the parietal cell. The parietal cell secretes intrinsic factor. Intrinsic factor is necessary to help vitamin B12 be absorbed in the intestines. So they will secrete that intrinsic factor into the lumen of the gastric gland, and then intrinsic factor will go up into the lumen of the stomach, and it will bind to vitamin B12, and now vitamin B12 can be absorbed. Okay. The parietal cells also are going to secrete hydrochloric acid, but they secrete it indirectly. They secrete hydrogen and they secrete chloride separately, and then the hydrogen and chloride combine together to form hydrochloric acid. And then hydrochloric acid will go up into the lumen of the stomach, and it'll help to dissolve and digest proteins. So what are the functions of hydrochloric acid? Let's look at that. So number one, it kills bacteria. Okay, it kills not only bacteria, it kills other microorganisms that are ingested with the food. Number two, it denatures proteins. So it's going to inactivate enzymes in the food so that those enzymes don't cause reactions in your own body. And then number three, it helps to break down plant walls and connective tissue from meat. Okay, plant walls and connective tissue, and that way you're able to absorb those more easily. All right, let's go back up here and let's take a look at another cell that's found in the gastric gland, and that other cell is the chief cell. So the chief cells are also found in between the mucus cells and the parietal cells, right? So the chief cells secrete a substance which is called pepsinogen. Pepsinogen is an inactive enzyme. It can't work until it's activated, and when it becomes activated, it then becomes pepsin. So pepsin is the activated form of pepsinogen. It requires hydrochloric acid in order to activate it. Okay, so those chief cells are releasing pepsinogen. And once it's activated, that pepsin will end up in the lumen of the stomach as well. The enteroendocrine cells are going to be found dispersed also among these cells, right? So I want to go and look at another page so we can talk about the different types of hormones that are produced by the stomach. So let's draw the stomach. So the stomach produces 7 different hormones. Gastrin is one of the hormones that is secreted by those enteroendocrine cells. It's secreted by G cells. We call them G cells. These G cells are going to be most abundant in the pylorus, so they're more down here than they are in the body of the stomach. And what the G cells do, what gastrin does, which is what the G cells secrete, Gastrin stimulates the secretion of parietal cells and chief cells. So it increases hydrochloric acid, and it also increases pepsinogen or pepsin. So we get both hydrochloric acid and we get pepsin. Now pepsin, what its main job is to break down proteins. It's going to break down proteins into little amino acids, and hydrochloric acid is going to activate that pepsin, and it's also going to break down the connective tissue and the plant walls. Right, so we've got some really good digestion going down here by the action of the G cells. All right, so let's look at the food as it enters into the stomach. So remember, in the esophagus, we still had the enzymes from the saliva working. So salivary amylase and lingual lipase are trying to break down the food that you just ingested in your mouth, and the esophagus then, through peristaltic contractions, pushes that food down into the stomach. As it reaches the stomach, that food has a pH of about 4.5. Now, in the stomach is producing hydrochloric acid, so it's going to decrease that pH. The hydrogen is going to be added to the solution inside the stomach, and the pH starts to drop. It takes about 2 hours for the pH to really drop, but after 2 hours, that pH is going to drop to about 2.0. So now it's getting pretty acidic, and that's from the hydrochloric acid. And then pepsin can be activated at this point. So pepsinogen becomes pepsin. Pepsin then at that lower pH level can then start breaking down proteins into smaller peptides and polypeptide chains, which can then be broken down into amino acids in the intestines, and then they can be absorbed in the intestines. So as all of this food in the stomach is being churned by the muscles of the stomach and being chemically digested, it becomes a real liquidy substance that we call chyme. The bolus of food now becomes chyme. Chyme then will be able to enter into the small intestine, and we'll see what happens to it once it's in there. Now, not a whole lot is absorbed in the stomach area, and that's for several different reasons. So first of all, there's mucus. The mucus lines the stomach wall, and it's very hard for things to get through that mucus to be absorbed into the cells and then into the interstitial fluid. The second thing is that the epithelial cells lack the transport mechanisms. So they don't really have any way to either co-transport or counter-transport or actively transport substances through the stomach wall into the stomach epithelium. The third thing is that the gastric lining is somewhat impermeable to water. So water's not going to get absorbed there, right? It's like a canteen. Water just stays inside the stomach. It's impermeable. It can't leak into the cells of the stomach. And the fourth thing is that digestion isn't complete. And so digestion isn't complete. All of these macromolecules have to be digested into smaller things. Proteins have to get digested down to amino acids. Carbohydrates have to be digested down to small, simple sugars like glucose. And then lipids have to be digested all the way down to triglycerides. And it's only those smaller molecules, the amino acids, the triglycerides, and the simple sugars, that can be absorbed. Anything bigger than that won't be absorbed. And in the stomach, most of those carbs, lipids, and proteins are only partially broken down. They're not broken down into those smallest molecules. Okay, there are some drugs, though, that can be absorbed in the stomach. For instance, ethyl alcohol. That can be absorbed in the stomach. Alcohol will be absorbed way before any nutrients in a meal gets absorbed and reaches the bloodstream. A meal that's high in fat is going to slow alcohol absorption because alcohol is lipid soluble, and it will dissolve some of the alcohol, so the alcohol won't be absorbed then. So one trick to avoid alcohol poisoning is to give a person a fatty meal if they've ingested too much alcohol, and hopefully the fat in that meal will break down that alcohol and dissolve some of it. Another drug is aspirin. Aspirin is lipid soluble, so it can be absorbed through the mucus and the membranes of the epithelium. If you have prolonged aspirin use, it could actually lead to gastric bleeding, since the aspirin does make its way through the mucus lining, and as it breaks down that mucus, and it exposes then those epithelial cells to the hydrochloric acid. So then the hydrochloric acid can damage those cells. Patients with stomach ulcers should definitely avoid aspirin.